Let's talk about MIPS Value Pathways and the new rules regarding these. Now, there are 6 new MVPs announced in this final rule. I won't go into the details here. They've combined 2 neurological MVPs into a single one. There's now 21 total MVPs available. Medicare estimates that 80% of providers now have an applicable MVP. They each require one improvement activity. Weights no longer apply to anything. There's no longer medium weight or high weight activities. They're all of one weight, and you need to do one in an MVP. You no longer need to choose a population health measure. There are 2 population health measures. MVP submitters had to choose one. Now they'll be scored on both of them, and the best score applied. If neither can be scored, it gets factored out of your submission. Now it's measured against the parent group. I imagine this is to be sure we more often get a submission that has a data completeness, more the minimum number of patients. Now, they're also aligning cost scoring with a new traditional MIPS policy. Cost is now, they're now coordinating the cost scoring scale with the performance threshold. So they're setting the median cost score for any cost submission. Any cost measure, not a submission, cost measures aren't submitted. For any cost measure that applies, your cost score, the median score is set at the performance threshold of the MIPS program, and then variation above and below that mean get divided into the typical 1 through 10 or percentile-like categorization. Cost measures like the pop health measures will be calculated at the parent group level. And again, I think this is a method to more often get minimum number of points in the denominator. The value in primary care MVP, which has had some modifications, and it's linked to a new payment method called the Advanced Primary Care Management Service. And they're considering a similar ambulatory care model for specialists in the ambulatory setting. So watch for more information on that, both the primary care, advanced primary care management program, and if they finalize a ambulatory care model for specialists in coming years. Now, perhaps the most important thing about MVPs for 2025 is what is not in the final rule. 2025 is penciled in as the year to make subgroups mandatory for submission of MVPs, but it looks like MVPs can still be used to score all providers in multi-specialty groups of any size and any specialty composition. So they've not yet moved on to that next step in the evolution to mandatory subgroup submissions, and made no indication whether it'll happen next year or when they're proposing to make that happen. And in fact, the only statement they made about the future is that they haven't determined yet when they'll sunset traditional MIPS and go to full-time MVPs. So that's you still have some years to get used to them, to test them, and a solid strategy for preparing for MVP submission is to do both an MVP and a traditional MIPS submission side by side and take the best score to set your MIPS adjustment.